Good afternoon, Long Beach. Today is our briefing for September the 23rd. Y después de las preguntas, tendremos también un resumen en español, como siempre tenemos. I want to update everybody on our numbers first. As of today, 11,684 residents have tested positive for COVID-19. Additionally, approximately 10,850 have recovered. And sadly, we have now lost 240 Long Beach residents to COVID-19, and so that's something that is, it's really sad. It continues to be sad, of course, for all of us, including myself, that have lost family members, and we want people to continue to stay safe. I want to just update everyone on the blueprint for reopening, and starting with a reminder. I've received a lot of questions over the last, particularly last week, about reopenings. And I just want to remind everyone that the reopening schedule is not set by the city. It is set by the state. And then the state puts out information on a weekly basis of whether or not counties meet the state's requirements. And so in our case, in Long Beach, we are part of LA County, all 88 cities. Even though we have our own health department, all cities are lumped in together. And so as far as when we can open, whether folks have talked about additional restaurants or movie theaters or all these other types of the economy, our Long Beach local health department does not set reopenings. It's set by standards that every single city and county in the state of California is now following. And it's this blueprint for a safer economy, color-coded system that we've been talking about now for a couple weeks. And so just as a reminder. And of course, we continue to remain in the same tier that we've been in, which is the purple tier, which is the most restrictive tier. But we're still making really great progress, and there's good news. For the LA County, our daily case rate is at 7 per 100,000, and our positivity rate is 2.8% in LA County. And if you think about the last few weeks, we're at 2.8% now. I mean, we were at 5%, we were at 8%, and earlier on we were at 13, 14% from a positivity rate at our highest peak. And so the fact that's coming down is really great news for Long Beach. The county's positivity rate is what they consider orange, and the case rate is what they consider red. So it's red and orange. But that does not move us out of the purple tier until we meet essentially 1 week more of keeping these numbers low. And that's the way the county sets, the state and the county set the rules. So if we keep these numbers that we currently have and they hold steady for another week, per the state's rules, we will then move into the red tier, which is the next little bit less restrictive tier. So again, we're in purple. If we hold for 1 more week, we go into red. And at that point, the LA County, along with our Long Beach Health Department, will have decisions to make about kind of what's next on a reopening schedule, and as far as what's next as it relates to health and safety at these locations. Also want to just remind folks that there's been a lot of discussion in the last day or two about nail salons. So the state has added nail salons as a type of business that can be reopened in the tier that we are currently in, with limited capacity inside their shops versus doing it outside, which is what they're currently doing right now. But to also be clear, the city of Long Beach cannot unilaterally open up nail salons. So we have to work with the county and the county's reopening process. And so we heard earlier today that LA County is going to be reviewing nail salons as an opportunity to reopen in the days ahead. A decision on that, honestly, is likely to happen sometime early next week, is what we understand from the county. But it could be earlier, but that's what we're currently hearing. And so the reason why the county is reviewing the data is because they're trying to determine if our numbers are beginning to go up a bit because of the Labor Day weekend. And so right now is around the time where we would start seeing the data around Labor Day and if we did have a spike. So if you look at the LA County numbers right now, over the last few days, there is a little bit of an uptick. And there's a little bit of an uptick in Long Beach as well. But it's not significant enough or sustained enough for us to understand if there really is a spike or if it's just a change in the data that we need to monitor. But we'll know more information in the days and the weekend ahead. That's when LA County is going to make the decision. So again, this is a decision the LA County supervisors, in consultation with the state, will make and working with us here as a city. The next item is something we discussed at length yesterday. Long Beach opened up a new testing clinic model. We have been testing an enormous amount in Long Beach, as everyone knows. Everyone is aware that we have testing sites across the city. Demand for testing has actually shifted over the last few months. We were at a peak just a couple months ago. But one thing that we've learned over the last few weeks is that a lot of members that are immigrants or from our undocumented community oftentimes don't feel as safe going to a testing center or even getting tested. But we also need them to get tested to keep everyone safe and them and their families. So we've opened up these testing mobile clinics that go into neighborhoods, specifically focused on communities that are disadvantaged, particularly immigrants and the undocumented, to ensure that they get tested. And of course, all tests are free, you don't need insurance, and we ensure that people have resources around those tests. And so we launched that program just yesterday. The first clinic was held today. I went by that clinic in West Long Beach, and there was a consistent stream of residents getting tested. We'll have 2 more pop-up test clinics in the days ahead. The next one that we have is this Saturday at Washington Middle School throughout the day from 8 a.m. to 2 p.m. And then on Sunday in North Long Beach at Star King Elementary, and that's from 8 a.m. to 2 p.m. And there'll be clinics in the weeks ahead. And so I want to thank the Long Beach Health Department and CHRTLA, which is a Coalition for Humane Immigrant Rights, for helping us run this new model of testing. And lastly, I want to just add something about the census. We are essentially at the end of the census process, and we are close. It is time to fill out the census if you have not already done so. Census results determine how much money we get to fight COVID, for food, to help the poor in our city, for our schools, and so much more. You can complete the census online, by phone, or by mail. And the easiest way is to go to my2020census.gov. my2020census.gov. It's just the easiest way to go ahead and fill out your census. And please do so today if you have not yet done so. It really helps your city out. And now we're going to turn this over to Dr. Davis, who will have some additional updates for everyone. Before I turn this over, I also wanted just to announce an announcement from our communications team. We have been doing, of course, our briefings pretty consistently since I want to say close to March or so. And we're going to continue our briefings, but we're not going to have a set date and time. So we've been doing these Wednesdays at 3 o'clock. We are going to be having briefings and press updates, but they'll likely be on different days and different times. Sometimes they'll be back on Wednesdays as well. It's just dependent on what's going on. There's a lot of shifting information and data and information being released on different days. And so while we won't be here every Wednesday at 3, we will continue to keep the public informed and have these press events and media events as needed, and oftentimes at other locations like we did yesterday with the Mobley Testing Center outside of City Hall. So thank you. And I want to turn this over now to Dr. Davis for more of an update.
Thank you, Mayor. Good afternoon. As the Mayor mentioned, we had our mobile testing unit at Westside Christian Church today, where we were able to administer 80 tests. We have the mobile unit scheduled throughout the weekend as well, and I really want to encourage the following, anyone who needs to get tested or feels like they need to get tested to be tested, but especially the following people. Anyone who has symptoms of COVID-19, anyone who's had close contact with someone with confirmed COVID-19, and people who have been asked or referred to get testing by their healthcare provider or by the health department. Remember, if you have access to a primary care physician or you're able to make an appointment at one of our stationary testing sites, it's best to reserve the mobile testing slots for others. And no matter where you're getting tested, make sure that you're adequately covering your face and mouth with an approved face covering. So to go over other reasons to wear face coverings, a growing body of evidence suggests that wearing a face covering while in public not only protects others if you're infected, but also reduces your risk of becoming ill from COVID-19 as well. We already know that face coverings help minimize the spread of infectious particles when the person wearing one speaks, coughs, or sneezes. But new research shows that wearing a face covering may actually decrease viral exposure between contacts. This means if you do become infected while wearing a face covering, your symptoms may be milder or even non-existent compared to someone who's not wearing a face covering. Again, I urge everyone to please wear a face covering anytime that you're indoors, besides your own home, or if you're within 6 feet of anyone you do not live with. Our goal is to keep our community safe and healthy. I know wearing these masks aren't always comfortable, and we're asking everyone to do something new by wearing them consistently when you're out and about. The best evidence right now shows that consistent mask use protects us and those around us, our friends, family, loved ones, the people ringing up our groceries, our coworkers. More and more research shows that when everyone wears a mask, we are less likely to get seriously ill, which keeps beds open in our emergency rooms for others and helps protect our hospital staff. So the science is clear that masks work and we can keep our community safer when we wear them. And I know these are challenging times for everyone, and the burden of this pandemic is being felt strongly by everyone. So I'm so grateful that most of us are doing our part to keep each other safe by wearing our masks, practicing physical distancing, and taking the other precautions recommended to prevent the spread of COVID-19. Now I'm going to turn to some new information regarding aerosols. So it's becoming more and more important, or more and more obvious, how important adequate ventilation and air movement is in preventing the spread of COVID-19. So we're seeing more and more evidence that there's more of a risk of spread of COVID-19 indoors and in poorly ventilated areas than when you're in wide open spaces and in outdoors where there's plenty of air movement. So I just want to encourage everyone in our community to think critically about the physical spaces that you're in, whether it's your workspace, the grocery store, other offices, other places. And whenever you have an opportunity to, I'd like to encourage you to move these activities outside into larger, more open spaces, or use fans or other ventilation systems to increase airflow. More air movement means that the virus can disperse faster, which means there's a reduced risk of exposure to higher doses of the virus. Of course, moving outdoors is only one of the many steps you can take to reduce the spread of COVID-19. Make sure you're still taking the other precautions, such as physical distancing, wearing a face covering, and frequently washing your hands and high-touch surfaces. So we're doing a great job, Long Beach. I am so proud of our community and our perseverance and our fortitude. And let's keep going. Thank you.
Thank you, Dr. Davis. We will now take questions from the media. We have a question from Haley at the Press Telegram. Go ahead, Haley.
Hi, Dr. Davis. I know the mayor briefly touched on this, but I was just wondering if you could expand a little bit more on what we know about Labor Day and, when it'll be clear whether or not there was a spike because of Labor Day.
Yes, thank you. So kind of like what the mayor said is kind of what we know, that there's been the slight uptick both within Long Beach's cases and also in Los Angeles County in general. And so I feel like it's going to probably take another week or two to really kind of see, is this going to be a sustained rise? Is it going to level back out, like go down? Or is it going to be a new plateau? So it goes up a little bit and then it kind of, stays at that level. So I would just say for us, we're kind of, we're watching every day. And so in the next week or two, I think we'll have a little bit more information. And then we can also see what happens with hospitalizations as well. That's another indicator that we'll be following.
Thank you, Dr. Davis. That concludes questions, and we will now move on to Spanish interpretation.
Muy buenas tardes, bienvenidos a nuestro comunicado de prensa para hoy miércoles 23 de septiembre del 2020. Empecemos con datos generales para la ciudad de Long Beach en relación a COVID-19. Hasta hoy, 11,684 residentes han dado positivos por COVID-19 y aproximadamente 10,854 ya se han recuperado. Hemos perdido un total de 240 residentes de Long Beach a causa de COVID-19. Como usted sabe, de acuerdo con el plan para una economía más segura del Estado que se utiliza para determinar las operaciones y realizar un seguimiento de las tendencias de COVID-19, el movimiento del condado está determinado por dos criterios. La primera es la tasa de casos y la segunda es la tasa de positividad de las pruebas. El condado de Los Ángeles, que incluye Long Beach y Pasadena, como he mencionado antes, esos dos se mencionan separados porque tienen su propio departamento de salud, pero son parte del condado de Los Ángeles, permanecen en el nivel morado, que es el nivel más restrictivo. Pero hay muy buenas noticias. La tasa diaria de casos es del 7 por cada 100,000 y nuestra tasa de positividad ha bajado a 2.8%. Si seguimos así por al menos una semana más, podremos o seremos elegibles para bajar al segundo nivel, que es el anaranjado. El número de tasa de positividad del estado está en el nivel naranja y el número de tasa de casos está en el nivel rojo. Sí, mencioné anteriormente, si eso baja, podemos bajar otra vez al nivel anaranjado. Dicho esto, quiero continuar recordándoles a todos que se cubran la cara y se laven las manos, que es la mejor defensa contra este virus. Otra cosa que queremos mencionar o que mencionó el alcalde es que el estado ha hecho un cambio que ahora permite que los salones de uñas abran bajo el nivel morado con una capacidad mínima. Y ahora el condado de Los Ángeles, el departamento de salud ahí, está revisando eso para ver si vamos a poder abrir, dado que hay una posibilidad que los números pudieron haber subido un poco después del fin de semana festivo, el fin de semana largo que acaba de pasar. Después de esto, si se ven que los números no están subiendo, se informará para la siguiente semana aquí en la ciudad de Long Beach si esos salones de uñas van a poder abrir en el nivel morado. Pruebas móviles. Las pruebas móviles de COVID-19 son importantes para todos y no importa si uno es documentado o indocumentado. Long Beach ha sido durante mucho tiempo un modelo para ofrecer pruebas en el estado de California. Nos hemos esforzado continuamente por aumentar las pruebas y ahora podemos realizar más de 1,000 900 pruebas diarias. Tenemos 6 ubicaciones en toda la ciudad donde las personas pueden obtener su prueba para COVID-19 gratuitamente. Es especialmente importante si tiene un trabajo que requiere que usted interactúe con muchas personas diferentes todos los días. Ayer mismo lanzamos una clínica de pruebas móvil. Es la primera de su tipo dirigida a inmigrantes. Los datos aquí en la ciudad de Long Beach muestran que estas comunidades representan más de la mitad de nuestras hospitalizaciones y muertes por el virus. Eso significa que nuestras comunidades latinas y afroamericanas también corren el riesgo de transmitir el virus a sus amigos y familiares. Sabemos de primera mano que ninguno de nosotros quiere eso. Por eso es tan importante hacerse la prueba. Se les recuerda que las pruebas son gratis, fáciles de hacer y no necesita tener seguro médico. Hoy tuvimos nuestra unidad de prueba móvil en el Westside Christian Church, donde se hicieron 80 pruebas. Este fin de semana tendremos 2 sitios de pruebas móviles. El sábado 26 de septiembre se ofrecerá esa prueba móvil en Washington Middle School de las 8 de la mañana a 2 de la tarde. Repito, las pruebas móviles se estarán ofreciendo en la secundaria Washington Middle School de 8 de la mañana a 2 de la tarde. El domingo se ofrecerán en el norte de Long Beach, ese es el 27 de septiembre, en Star King Elementary, también de 8 de la mañana a 2 de la tarde. Queremos agradecerle a nuestro Departamento de Salud de Long Beach por hacer posible estas pruebas móviles y a nuestros socios de la Coalición por los Derechos Humanos de los Inmigrantes por ayudarnos a brindar confianza a las pruebas de COVID-19 a todas nuestras comunidades. Recordemos que si usted tiene acceso a un médico de atención primaria o puede programar una cita en uno de nuestros sitios de prueba fijo, es mejor que reserve espacios de prueba móviles para otros que quizás no tengan transportación o otra oportunidad para ir a esos locales. Y no importa dónde se haga la prueba, asegúrese de cubrirse adecuadamente la nariz y la boca cuando llegue. El census, faltan solo unos días para la fecha límite para completar ese censo. Tenemos hasta el 30 de septiembre para completar el censo del 2020. Los resultados del censo ayudan a determinar cómo nuestra comunidad recibe dinero para servicios de emergencia, hospitales, educación y también infraestructura. Para recibir nuestra parte justa de los fondos para estos importantes servicios, necesitamos que se cuente a todas las personas en la ciudad de Long Beach. No importa si son indocumentados, por favor, asegúrense que usted cuenta. Ahora es el momento de unirnos y hacer nuestra parte. Hay 3 formas de responder al censo: en línea, por internet o por teléfono o también por correo. Los residentes que viven en una vivienda, apartamento, condominio tradicional deben haber recibido un correo de la oficina del censo con un código de 12 dígitos. Sin embargo, los hogares no necesitan un código de identificación para poder responder a este censo en línea o por teléfono. Por favor, visite a www.my2020census.gov. Se los voy a deletrear: www.my2020census.gov. Para responder por teléfono, por favor, llame a la área 844-330-2020. Los residentes pueden responder en 13 idiomas disponibles. El Census 2020 es importante y todavía hay tiempo para contar. Y recomendamos que también hablen con sus familiares por teléfono para asegurar que ellos también ya hayan completado su formulario. Cubiertas de cara. Un conjunto de pruebas concluye más y más que usar una cubierta facial en público no solo protege a los demás si está usted infectado, sino que también reduce el riesgo que uno mismo se vaya a infectar por COVID-19. Ya sabemos que las cubiertas faciales ayudan a minimizar la propagación de partículas infecciosas cuando la persona que las usa habla, tose o estornuda. Pero una nueva investigación muestra que usar una cubierta facial puede disminuir la exposición viral entre contactos. Entonces, si usted la trae puesta y alguien más la tiene, es menos probable que usted vaya a recibir ese virus. Eso significa que si se infecta mientras usa una cubierta facial, sus síntomas también pueden ser más leves. La cubierta facial también puede filtrar la cantidad de infección que usted está entrando a su cuerpo y puede causar una infección más leve, incluso inexistentes en comparación con alguien que no usa una cubierta facial. Nuevamente, urgimos a todos que se cubran la cara cada vez que se encuentren en el interior de un lugar, con excepción de su propia casa, o si se encuentran a menos de 6 pies de alguien con quien usted no vive. Nuestro objetivo es mantener a nuestra comunidad segura y sana. Sé que las máscaras no siempre son las más cómodas, pero les pedimos que por favor la usen constantemente cuando estén fuera de sus casas. La mejor evidencia muestra que el uso constante de esas cubiertas faciales o mascarillas nos protegen a nosotros y a quienes nos rodean, nuestros amigos, familiares, seres queridos, las personas que llaman a nuestras compras y a otros trabajadores. Cada vez más investigaciones muestran cuando todos usan una máscara es menos probable que nos enfermemos gravemente, lo que mantiene las camillas abiertas y disponibles para otras personas que requieren asistencia de emergencia en los hospitales. Se han hecho comentarios de que las máscaras no son efectivas o que infringen los derechos, pero la ciencia es muy clara. Las máscaras funcionan y podemos mantener a nuestra comunidad más segura cuando las usamos. Sé que estos son tiempos difíciles para todos y que todos sienten con fuerza el peso de esta pandemia. Dicho eso, estamos muy agradecidos de que la mayoría de nuestra comunidad todavía esté haciendo su parte para prevenir la propagación de este virus. Hablando de otras precauciones, quiero recalcar la importancia de una ventilación y un movimiento de aire adecuados para prevenir la propagación del virus. Vemos cada vez más evidencia de que el coronavirus o COVID-19 se propaga mejor en interiores y en áreas con poca ventilación que en espacios amplios y abiertos con mucho movimiento de aire. Es por eso hemos visto los restaurantes que ahora ofrecen comida por fuera, servicios de salón y uñas también que ofrecen esos servicios por fuera. Quiero recomendar a la comunidad a pensar críticamente sobre los espacios físicos en los que usted se encuentra. Piensa en su espacio de trabajo, el consultorio de su médico y los baños públicos. Siempre que exista la oportunidad de hacerlo, le recomendamos que traslade estas actividades al exterior, a espacios más grandes y abiertos, o que agregue ventiladores o utilice sistemas de ventilación que aumentan el flujo de aire. Más movimiento de aire significa que el virus puede disiparse más rápido, lo que significa un menor riesgo de exposición a altas dosis del virus. Por supuesto, mover actividades al aire libre es solo uno de los muchos pasos que puede tomar para reducir la propagación de COVID-19, asegurándose de seguir tomando precauciones como distanciamiento físico, cubriéndose la cara y lavándose las manos con frecuencia, y también limpiando las superficies de alto contacto. Ahorita estamos haciendo un gran trabajo y queremos agradecerle a todos ustedes por acompañarnos. Una nota que mencionó el alcalde es que los comunicados de prensa no serán ahora cada miércoles a las 3 de la tarde como han sido estos últimos meses. Los tendremos como necesarios para comunicar información importante. Nos puede seguir por medios de redes sociales para saber cuándo vayamos a tener esos comunicados de prensa. De nuevo, les agradecemos por habernos acompañado. Esto es todo por hoy. We thank you for joining us. That is all for today.